ready to go if I can find my screen. Yep, here we go. So we are at the end of um, the celebration of scholarship. We've had 2 days. We did podium presentations last Friday, and we're doing poster presentations today for our graduate students, and we're at our very last speaker. So Nicole Bardoczi will be speaking today about using a cognitive aid to implement an anesthesia-specific airway fire drill. Sorry, I was trying to read and click admit at the same time. So Nicole, I'm going to stop my screen and we'll pass it over to you.
Okay. Everyone see it? Well, I assume you do. Okay. So good afternoon. My name is Nicole Bardoczi, and I will be presenting my DMP project, Improved Patient Safety Through Implementation of a Cognitive Aid During an Airway Fire Drill. Thank you all for joining me for my DMP presentation. I know it's been a long day. This project was implemented at a small private level 2 trauma hospital where an anesthesia airway fire drill was implemented using a cognitive aid. I will begin with highlighting background research on the presented topic, focusing on airway fires, operating room fires, training, and cognitive aids. The Centers for Medicare and Medicaid Services consider operating room fires a never event, recognizing that they are preventable and should never occur. Reported operating room fire occurrences range from 217 to 600 events annually. However, not all states are required to report, therefore the actual number is expected to be higher. Procedures that are at or above the level of the xiphoid process account for 85% of malpractice claims, while procedures involving the face, head, and neck account for 65% of fire claims. Operating room fires are preventable when all members of the team, anesthesia providers, surgeons, nurses, and technicians, exhibit open communication and are trained in the prevention and management of this catastrophic event. The Joint Commission advises healthcare organizations to develop, implement, and test operating room fire safety drills to evaluate the response of surgical team members. Utilizing memory alone to adhere to the critical steps in the management of rare operating room crises commonly leads to deviations in treatment and patient outcomes. The Stanford Emergency Manual was developed by the Stanford Anesthesia Cognitive Aid Group after observing clinicians key steps in the management of operating room crises. Furthermore, randomized controlled trials, specifically one published by the New England Journal of Medicine, had evaluated operating room teams in 106 simulated surgical crisis scenarios, and they found that a 75% reduction in missing crucial steps. Of the 371 critical steps in the simulation surgical crises, only 6% were missed when checklists were available, compared to 23 that were missed without the aid available. Purpose. The purpose of developing and implementing an anesthesia-specific airway fire drill is to synchronize the application of key steps in the prevention, recognition, and management of airway fires to improve patient outcomes. Going on to the framework. The framework of this study included an implementation framework, which was the Iowa model of evidence-based practice, as well as a theoretical framework, which is Florence Nightingale's nursing theory. The Iowa model of evidence-based practice served as the implementation framework for the anesthesia-specific airway fire drill. The succeeding steps of the Iowa model are provided to facilitate the implementation of evidence into practice. The first step is to identify a topic for practice change. As previously mentioned, the purpose of this study is to synchronize the application of key steps in the prevention, recognition, and management of airway fires to improve patient outcomes at a private level 2 trauma hospital. The second step is to form a team and develop a solution. The team was composed of the project leader, myself, the project chair, the project practice mentor, and the project consultant, which was the anesthesia program director, Executive Director of Anesthesia Services, Clinical Anesthesia Operations Manager, and also staff anesthesia CRNAs were part of the team. The next step is to assemble, critique, and synthesize literature. There were 19 articles chosen and highlighted topics were previously discussed in the background. The next step is to design and pilot the practice change. The team members discussed the guidelines attained from the literature review and the selected recommendations to pilot the airway fire drill. The Stanford cognitive aid was used in the implementation of the airway fire drill. The last step is to integrate and sustain practice change, which I will discuss shortly. Going on to the nursing theory, Florence Nightingale's nursing theory focused on the modern concepts of physical environment, psychological environment, nutritional status, nursing care planning, and management. I would also like to highlight Florence Nightingale's assumptions that pertain to this project, which emphasized that nurses should be trained. The environment is important to the health of the patient. Nursing's concern is with the person in the environment, and the person is interacting with the environment. Nightingale described the goal of nursing as assisting the patient retain vital powers by meeting their needs, which includes putting the patient in optimal condition for nature to act upon. The patient's ability for self-healing depends on the nurse to create a supportive environment that promotes healing, which emphasizes the nurse's duty to manipulate the environment. Nightingale highlighted that experience is what grounds these concepts, and that one's observation is the only reliable means of procuring and confirming knowledge, which can be looked at as early evidence-based practice. Methodology and implementation. The anesthesia-specific airway fire drill was conducted at a private level 2 trauma hospital. A total of 8 CRNAs participated in the fire drill for data collection. The participants were read an invitation to participate, followed by a clinical scenario of a patient with an airway fire. The participants had 2 minutes to complete all critical components on the Stanford Emergency Manual, at which time the project leader checked off each step in the first column, labeled pre-aid, as they were completed. Once the 2 minutes were up, the participants were given a copy of the Stanford Emergency Manual, which they were able to use as a reference to verbalize all the critical components, and they had another 2 minutes to do so. Once the drill was over, the participants answered debriefing questions and completed an evaluation of the airway fire drill. Of the 11 steps, and the Stanford cognitive aid is located in the center of the poster. Of the 11 steps, both groups missed the same 3 steps without the use of a cognitive aid, which included examining for injury and examining and removing residual material and saving the material for further investigation. Once the cognitive aid was present for the second 2 minutes, all participants completed all the 11 steps. There were 8 questions which the participants had to rate as strongly disagree, agree, and strongly agree. All participants agreed or strongly agreed to the following. The overall experience during the anesthesia crisis management scenario was beneficial. Additional knowledge was gained during the anesthesia crisis management scenario. I felt my response to the airway fire was improved with the use of the cognitive aid. The events that took place during the scenario were realistic. I felt more confident in the treatment of an airway fire with the cognitive aid present. The anesthesia crisis management scenario provided a suitable format for ensuring correct actions, and I would encourage colleagues to utilize a cognitive aid during the management of an airway fire drill. Participants were then given the opportunity to provide additional feedback regarding the drill. They were asked to provide additional feedback regarding the anesthesia crisis management scenario, provided feedback for what they felt went well in the scenario and what they did not feel went well in the scenario, and if they felt the cognitive aid would be beneficial to have at all times in the operation. The participants agreed that the airway fire drill was a great refresher of knowledge that they don't have the opportunity to experience on a regular basis, fortunately, as airway fire drills are rare events. And they all agreed that having a copy of the cognitive aid in all operating rooms would be highly beneficial. As a result of the project, the anesthesia department will hold an annual airway fire drill, and the cognitive aid, copies of the cognitive aid will be placed in all operating rooms. There were a few limitations of the study. The project leader is a novice researcher. The sample size was small with only 8 participants. It was a convenient sample. The fire drill took place during normal work hours, and the CRNAs that participated were CRNAs that were available that weren't in cases. And the project leader was unable to recreate an actual simulated airway fire. Further recommendations are to require CRNAs to complete the annual airway fire drill. As mentioned, include the Stanford Emergency Manual in all operating rooms. Pilot the implementation of the Stanford Emergency Manual for use by CRNAs. Evaluate patient outcomes after implementation of the Stanford Emergency Manual, which can be documented as a reduction of missteps in the management of surgical crises, and conduct further research focusing on the education of airway fire prevention. All the sources are available upon request. I did not include them on my poster, but I have a copy if anyone would like a copy of the sources I used. I would like to thank Dr. Jessica Hale, Dr. Flatley, Dr. Kiefer Griffin, Dr. Gephardt, and Lindsay Berry, as well as all the CRNAs at the private level 2 trauma hospital. Without all you guys, I wouldn't have been able to do this, and I greatly appreciate everything. Any questions?
Yeah, this is Dr. Jessica Hale.
Hi,
So,
Dr. Jessica Hale.
What's your biggest takeaway from all of this project business?
Well, I have probably about 3. I would say realizing the importance of the nursing theory and putting together a project kind of helps back up why you're wanting to do this. So I guess realizing the importance of that is a big takeaway. Second of all, just knowing that there are resources available and having this cognitive aid is a huge help in certain scenarios. And as 2 previous projects have demonstrated, the cognitive aid was beneficial and showed improvement in actions.
Once again, you students have scared me half to death with all these crazy things that can happen. But I know they don't happen often, but I don't know, it scares me to death. Nice job, Nicole. It was great to work with you.
Yeah, thank you so much, Dr. Jessica Hale. It's been a great experience and I appreciate everything.
Yeah. Hey, Nicole, we have Dr. Griffin's here. She wants to ask you a question.
Hi, Nicole. Great job. I just wanted to say, you did a great job as the project leader, though, because it was very non-intimidating. I think sometimes when people are put on the spot a little bit to, do these types of education things, you did a great job with that. So I thank you. And we're looking so forward to using this in the future. So it's going to be great.
Oh, thank you so much. And thank you for your help in this project also and being a part of the team. You guys are all, can't do it without the team. So thank you. Any questions?
All right. Nice job, kid.
Yay, thank you.
Congrats, Nicole.
Great job, Nicole.
Yeah.
Congratulations, Nicole. We're very, very happy that you have finished this step, and we'll be excited to watching your last several months in the program as you conquer your C's and get ready to leave us. So,
Indeed.
Yeah. Just hang around if anyone's got any questions.